COVID-19 attacks your lungs, can lead to lung damage and inflammation that makes it hard to breathe. That's what makes ventilators so important right now. So, what is a ventilator and why is there a shortage? A ventilator is a breathing machine that assists with lung function. A ventilator can deliver oxygenated air to the lungs and help reduce elevated levels of carbon dioxide in the body. For those who need ICU care because of coronavirus, these ventilators could keep them alive long enough for their body to fight off the virus. But the problem is that there just aren't enough ventilators. An analysis from the Johns Hopkins University Center for Health Security in 2018 estimated that in the United States there were about 160,000 ventilators. Under normal circumstances, that's usually enough to serve everybody that needs one. But for now, there's a severe shortage in the coronavirus pandemic. The American Hospital Association has estimated that due to the coronavirus, nearly 1 million Americans could require ventilation, and some of them may need to stay on their ventilators for up to 2 weeks. Where are those extra ventilators gonna come from? It isn't easy to answer. Typically, it costs tens of thousands of dollars each ventilator. That makes it hard for hospitals, especially ones serving the lower income communities, to keep a bunch laying around just in case. And this is a global pandemic. Countries all over the world is trying to buy these ventilators all at once. The ventilator producers have reportedly ramped up production as much as possible. And several non-medical companies, General Motors, Ford, and Tesla in the US, have also offered to help. Also, it makes it easier for those companies to enter the ventilator business. The FDA has relaxed some guidelines, but when they can actually start producing ventilators is still a big concern. Since January, factories in China have been working around the clock. They continue to produce ventilators for the global market, although there is their own country's need for ventilators weeks ago. Ventilators require precise control because if the settings are wrong, it can cost someone's life. It can damage the lungs if there is too much pressure pushing air in, and if there is too much oxygen, it can lead to a condition called oxygen toxicity. That's why ventilators need to be precisely made and controlled. Public health experts have said in the national stockpile there are about 12,000 ventilators, which is far from enough for the needs. Therefore, health officials have even considered using one ventilator for 2 patients. If we fail to get enough ventilators, may we experience what has happened in Italy, where nurses and doctors have had to make gut-wrenching choices about who gets access to a ventilator and who gets left to die. For now, the best thing we can do is practice social distancing well and wash our hands often in an attempt to flatten the curve and slow the rate of infection.